Hey, so happy birthday to me. It's my birthday. I'm 30 years old now. I know a few of you have asked my age. I guess that makes a difference, you know. Maybe, maybe not. I don't know. So I just did a video earlier this morning, and I should be out and partying, and I'm about to go and, have dinner with friends, family. And, but, because I just had my surgery, I really don't want to drink, party hard, none of that stuff. If you're taking Vicodin, you really shouldn't be drinking and things like that. I haven't taken Vicodin, but I'm just saying if you're taking Vicodin, don't drink. Or you can do what you feel like you're doing. So that's my head. And so I saw, just to catch you guys up, I did that video this morning, and I went and saw Dr. Benham today around noon or 2 p.m. and he actually removed the bandages and he cleaned it for me. And so I know Yoshida, I think you were asking me about how does my head look, when does the scarring go away, and this is literally a day after the surgery. This is what it looks like. So if you were concerned about people looking at your head, some people have told me it looks like I just have scratches on my head. If they even notice it, if they pay attention. Most people don't. The people I just asked randomly, friends, family, whoever I've asked, those are the people I'm talking about. So that's what my head looks like a day after the surgery. I just got it yesterday. I put up the video. I had bandages on. This looks a lot more cleaner than the one I did a couple days ago for the first surgery because he cleaned it a lot better. And you're noticing that white goop on my head because that's like the Acell Neurosporin. He puts a thick layer of it, so it might be also hiding some of the surgical scars. But the fact is that it can be like hidden just with that goop. You can tell. I think here on the side is from the first day of surgery actually, and you can't even see it. And that's only been what, 2 days? I got Tuesday. Today's Friday, so what? Wednesday, Thursday, Friday, 3 days, and it's pretty much gone. You really don't see much. So if you're concerned about the surgery, how long are these scars on the back of your head, doing FUE, that's the best part. And you can watch the one from a year ago even. I did a time lapse on that, and you can watch those videos too and see, when doing FUE, these scars and stuff, they all go away quite quickly. So if you're concerned about that, get it done midweek. You have the weekend if you're off work. I don't know what job you have, and then plan accordingly. If you wear a cap, nobody's going to tell or notice. Any stinging and tenderness, for me, I've seen other people's videos, but it mainly goes away by the second day. So I had surgery yesterday. By tomorrow being Saturday, my head feels fine. I can put a cap on. I can touch the back. It feels like slight, like if you had a bruise on your skin. That's what it feels like. So it's not that bad. Everything else has been the same. So spraying my head every 10 minutes. Feel free to ask me any questions. Like I said, I'm doing the time lapse of the healing, but I don't know exactly what you'll see this time because it just looks so clean already. And that goop, like I said, is a Neurosporin, that Acell thing that you put on your head. And and I spoke to Dr. Sean today, and he said he's been getting a few people from my videos, and if you haven't heard of him, Dr. Sean Benham in Santa Monica, California, go ahead and have a consultation with him. I think you'll really like him. You'll find he's quite an honest guy. Compared to other transplant places I've been to, they're more into like trying to do sales. Some of them are very just up for it about the money. They're like, you pay this much, we'll do this. They're very brute about it. He talks you through the whole thing. He doesn't force you into it. He's not looking to force you into doing anything as far as the hair transplants. And he's just very upfront and honest and gives you some real expectations of what you can expect. I know that makes sense. But talk to him. If you're considering doing at least some consultations, consider him as one of the people. And if you mention me, I think he's willing to give some kind of a discount or something. Something. So mention me that you saw Sam on YouTube, and maybe he'll work some deal out with you. Maybe he'll give you some type of special. He hasn't told me anything about that. I asked him about it, and he said, you know, just mention it to him, and I'll ask him again, see if he can give me something more specific, and I will. I'll mention on his YouTube, and yeah. So leave me any questions, comments, concerns. I'm gonna just keep giving you guys follow-ups like I usually do. Look at my past videos if you want to see my first surgery, how bald I was a year ago. I didn't even have this hair up here in the front. Was not there, did not exist on me last year. So, you know, it looks very natural. I know the hairline is still a little bit high, but I've been thinking about hairstyles I want to do. I want to be really delicate with my hair now, and I'm really happy. I know this hair is like very permanent, but when it grows out more, including the crown, then I'm just going to have like the barbers use scissors, trim it on the sides, and keep the top long enough and front enough and clean cut right here, just so I have like this little bowl type of kind of. It sounds silly, but we'll see how that ends up looking. In my head, I'm imagining something very classy, cool looking, but we'll see how that grows out. The fact that I have that option is pretty awesome, and even just keeping this short hairstyle right here, I think this is a hell of a lot better than where I was when I was bald. From the front, it looks very just a clean cut, very soldierly style thing. From the top, I know you can notice how thin it is, but again, I'm right under a light. And again, when it grows out, just that little bit of longerness, it really covers it up quite well. So I have options for doing a neat haircut. And this has been nothing in my hair. I know I've gotten comments and people saying, why don't you use different products? And I have done a Hair Cube commercial. They paid me, so I said, oh, my hair is a perfect length, so I did it beginning of this year. I've told you guys about it. If you search Hair Cubed, I've put the link in previous videos, but if you want, just search Hair Cubed. I think I'm like the second video on their thing. You'll see me talking. I actually applied it on my head, and that was actually the first time I ever used it in that commercial, and I was amazed by it. They actually gave me some free product. It's in my cabinet down there. I haven't used it since because I really don't want anything messing up my growth of my hair transplant. Right now, that's my biggest concern, is make sure that grows well. Also, I talked about using Monostat on my head, which is a vaginal cream. Dr. Benham actually told me about that. If I do start using it, I don't want people to... It's tough to tell when you have hair now, you know, what's working, what's not. So if I did apply it, I'd apply it to this front of my head right here, and I would just use it maybe for like 4 or 5 months and see if that remains or if it gets thicker or what, you know, just see the results on the top right here in the front to see if it even does anything on the hairline. I've had people talk to me, oh, use this oil, use this, use that, you know, as I'm sure you guys have dealt with it too. When you're balding people and their suggestions, sometimes it's just genetics. If something really worked, then they should be a billionaire, because finding the cure for baldness will probably make them a billionaire. Any special oils claiming that they're going to work, maybe it might strand your hair, maybe they might do stuff, but I'm bald right here in the front, and if what they're recommending grows back hair right here, then I will be a believer. Otherwise, there's nothing else that will do that except a hair transplant. There's nothing. Maybe stem cells even. I've been looking into that recently. If you have any information on stem cells, I'd love to hear about it. I know I first heard about it in India, and I did videos on that, and I even have Dr. Nigam talking about it in the videos. So definitely check those out. Let me know what you think about stem cells. And yeah, I'm just going to keep you guys up to date on my progress with my hair transplant. Now, this is my second one. I got it just right here in the crown area. I didn't do anywhere else, just the crown. It was approximately 1,200 grafts in the crown and approximately 2,300 grafts I did in the front area last year. But you know, the FUE, it's I'm always surprised how fast this heals up, you know, like I'm feeling already great. I just had it done yesterday. You're seeing me chit-chatting, making this video. I'm ready to go. I'm going to be going to work on Monday. I'm going to be probably partying on Sunday. I mean, I still take it easy for the sake of healing. I want to get the best results possible. I'm not a big drinker, so not drinking to me is not a problem. And you know, I'm going to avoid loud noises and stuff.